Our starting point, as per usual, is the COVID-19 situation. South Korea expecting to see new daily cases hover around the 200,000 mark on Tuesday, with the death toll expected to rise further in line with this surge of Omicron.
Now, given the current situation, authorities have said Omicron does not pose a serious threat to people's health if they have gotten their boosters. For more on this, our reporter Choi Min-jung is here in the studio with us. Good morning, Min-jung. Welcome back.
Good morning.
So let's start with the local front. What are you expecting today?
Right, Mok-yeon, we're expecting to see more than 200,000 cases today. From midnight to 9 p.m. Monday, South Korea saw over 196,000 cases. This is down by around 3,500 cases from the day before, but still a 1.5-fold increase on week and double what was seen 2 weeks ago. With cases continuing to surge, authorities are bracing for further upticks in the number of severely ill patients as well as deaths. With 70 added just yesterday, we saw close to 1,000 critically ill patients, and authorities say this figure could potentially increase to more than 2,700. We've also been seeing daily numbers of deaths in the 3 digits, higher than what we witnessed at the end of last year when the Delta variant was prevalent. Authorities are expecting the death toll to continue to soar 2 to 4 weeks after the Omicron wave hits its peak.
Now, Min-jung, given this current situation, Korea has raised its risk level. It's now the highest point on its 5-tier evaluation system.
Right, Mark. The country's overall COVID-19 risk was bumped to very high over the past week. This, as you said, is the highest level in the 5-tier evaluation scheme. And it's the first in 9 weeks that the country has been designated as being at this level. Individual risk levels for both the Greater Seoul area and outside the capital region were also upgraded to very high. The KDCA chief explained that the revision comes as the occupancy rate for ICU beds continues to increase, passing 50%, and the number of deaths are expected to increase as well, with more people over 60 getting infected. Now, this also comes as recent data show that the Omicron strain accounted for 100% of infections. The subvariant of Omicron, also known as stealth Omicron, accounted for 23% of domestic cases, and the figure doubled within just a couple of days. All we know for now is that the stealth variant is 30% more transmissible than Omicron, but there are no significant differences in how severely it affects one's health or how effective vaccines are against it.
Well, on that point, Min-jung, authorities are saying the Omicron variant doesn't really pose a serious health threat if you got boosted. Tell us more on that.
Right, Mok-yeon. Authorities revealed on Monday that the fatality rate is 0% for people under 60 who were infected with Omicron after getting booster shot. For people who are 60 and over, the rate increases to 0.52%, and the rate is around 5.5% for unvaccinated people in this age group. Over the past 3 weeks, the fatality rate of Omicron stayed at 0.1%, and authorities say the weekly fatality rate is getting to a point where it is similar to that of the seasonal flu, which is known to be around 0.05% to 0.1%.
Okay, so that's quite reassuring to hear that the fatality rate for Omicron, in particular, is still relatively low, especially if you're a younger person. But staying on the vaccination front, even though they're much more unlikely to get seriously ill, vaccinations for children, providing they have their parents' consent, of course, between the ages of 5 to 11, will soon be able to get vaccinated.
That's right. Health authorities are planning to announce detailed plans on inoculating children aged 5 to 11 next Monday. Last month, the Ministry of Food and Drug Safety gave the green light for Pfizer's vaccine for kids in this age bracket. Authorities are saying that it is important to vaccinate those who are at high risk or those with weakened immune systems, as the studies show that the vaccine is effective in preventing severe illness. Their decision also comes as the virus is spreading rapidly among those aged 11 and under. Last week, infections among children in this age group stood close to 32,000, and this is an increase of tenfold compared to what was seen a month ago. Given the situation, authorities say they will put much effort into administering vaccines to young children as soon as possible.
All right, Min-jung, thank you so much for your report. Talk to you again soon.
Thank you.